This is probably the conversation I have more than any other. It starts with, Aaron, I've just been referred to see a specialist. The NHS has told me it's going to be a 3 or 4 month wait. Can I take out the insurance and use it instead? And honestly, I completely understand why people ask. Most people don't think about private health insurance until they actually need it. Unfortunately, that's not how it works. Health insurance is designed to protect you against future, unforeseen medical conditions, not something that's already started or something you are already being investigated for. Once you've seen your GP, been referred, started having symptoms investigated, or received a diagnosis, that condition would almost always be treated as pre-existing and wouldn't be covered by a new policy. Now, does that mean you have no options? Not necessarily. You can usually choose to pay privately for your consultation, scans, or treatment directly with the hospital or consultant. But depending on what you need, that can become very expensive, particularly if surgery or ongoing treatment is involved, or the problem is difficult to diagnose. This is where I often ask people to look at things slightly differently. I tell them that they've reached a crossroads. One road is to carry on exactly as they are. If another medical issue or injury comes along in 6 months' time, what if the next issue is more significant or serious? They are more than likely going to find themselves in exactly the same situation. Waiting, feeling frustrated with the unknown, hoping the NHS waiting list moves quicker. These concerns don't just disappear. They are real and can impact massively, and if anything, only going to get worse. The other road is to say, I can't change what's happening today, but I can make sure I'm never in this position again. That's what private health insurance is really for. It's not about solving today's problem. It's about protecting your future health. It's about knowing that if something unexpected happens next year, or the year after, you'll have fast access to specialists, diagnostic tests and treatment, without wondering how long you'll have to wait. None of us knows what's around the corner, and our health can be unpredictable. In over 10 years, I've never had a client tell me they regretted taking out private health insurance. But I've spoken to plenty who wished they'd arranged it sooner. I speak to plenty of clients that do have medical conditions, and you are doing really well if you haven't. But we can decide how prepared we'll be when life throws us the unexpected. Sometimes the best time to arrange health insurance isn't when you need it, or after you have been caught short. My advice is get it done whilst you're in good health. You can't change the past, but you can protect the future. I hope that's helped clear up one of the biggest misconceptions about healthcare. Thanks for watching, and I'll see you in the next video.